Thousands of Oklahomans flooded the hallways and rotundas of the state capitol, asking lawmakers to fund mental health and rehabilitation services. So many people showed up that more than 1,000 had to stand outside the building. But for all of their numbers and all of their stories, it wasn't enough to change lawmakers' minds.
They seemed to be everywhere. The swarm of green hats gave the Capitol's fourth-floor rotunda the look of a Christmas gathering. But the huge crowd at the state capitol did not have Yuletide greetings on their minds for state lawmakers.
You have made a significant showing to the people in this building by being here today and showing that you care about these services and you want to see them funded properly.
Joe Dorman is CEO of the Oklahoma Institute for Child Advocacy, and his message to the crowd was clear and simple.
We are here today to show legislators and our governor we are serious about wanting a solution today.
What the group was being urged to do was lobby lawmakers to pass a GOP budget plan. Robin Arter is executive director of Think Ability, Inc., which provides services to the developmentally disabled in southern Oklahoma.
It's not a perfect plan, but it's a good plan. And as I understand it, it keeps us from further cuts. So my message to my legislator when I go talk to them is to ask them to support this plan.
But many of those who came to the Capitol really did not care much for the GOP budget plan. Jeff DeVault is a registered nurse who works as a pediatric psych nurse at Children's Recovery Center in Norman.
It's sad to me that we're asked to and encouraged to accept a plan just because it's a plan.
DeVault found a twisted kind of irony in that plan.
We're taxing the addicts, the very people that we provide services to. So we're cutting their services. We're adding $1.50 to their pack of cigarettes that they're addicted to. We're adding a tax to their alcohol that they're addicted to. It is a sickness. We have people in the state that are addicted to their money, but we're not cutting them. We're not asking them to pitch in.
Amid the chance to save our services were people who own rehab facilities, employees of those facilities, and clients, like Lisa Green, who is on the verge of graduating from drug court, a service that will be cut if lawmakers do not act.
Drug court saved my life. If it wasn't for drug court and Gateway and teaching me a new way of life, I would probably be in a ditch somewhere.
Lisa's drug of choice was methamphetamine, a drug that she has now been free of for 19 months.
It is a struggle every day, but it's learning the tools that they teach us at NA and in these places right here. You learn how to manage it. I mean, I'm always going to be an addict, but today I don't have to be an active addict.
Erica Choate is a mental health advocate from Hope Community Services.
It's so hard to realize you need help. And then when you realize you need help, you have to be able to walk through the door. If these people take away the funding, there won't be doors to walk through anymore.
And Ms. Green knows there are a lot of Oklahomans who can't walk through those doors now.
There's thousands of other people that are suffering from addiction right now, that are suffering from not being able to have insurance to pay for their mental health problems. And if you shut them down, you're going to have more deaths. You're going to have more people in prison that we don't have room for.
Jeff DeVault says if the Mental Health and Substance Abuse Services Agency does make the cuts it has already announced, it will directly impact his facility, which is one of the few state-owned and operated mental health treatment facilities left.
We would keep our 13 to 18-year-old substance abuse dorms, but we would lose funding for our mental health issue dorms. Some of the sickest kids, the despair that Oklahoma families are in because of a mentally ill child or an addicted child at 13 or 12, or we had a 5-year-old the other day.
But for all their stories, chanting, and sheer numbers, it was not enough to convince members of the Oklahoma House to find a way to agree on a budget bill that would put the 2018 fiscal year budget back in balance and find new revenue to avoid ongoing budget cuts that continue to decimate health care and many state agencies.